If you have a wound that hasn't healed up in a month, you probably ought to get another opinion about it. And usually a wound that hasn't healed in a month has some underlying problem that's keeping it going. And you need to figure out what the underlying problem is in order to be successful in getting it healed. We have vascular surgeons, general surgeons, podiatrists. We have diabetic specialists. We have some other types of internists that occasionally work in the clinic, plastic surgery, and as needed, we will have people from dermatology. Each physician has a special kind of expertise that they bring to the table. And so you want to leverage that expertise, and it makes the group better than a collection of individuals. Most of the wounds that we take care of have been present anywhere from a week to 25 years. There are quite a variety of wounds. We see wounds from arterial insufficiency where someone doesn't get enough blood supply to their foot. We see a lot of diabetic wounds, venous wounds that come from high pressure in the veins causing breakdown of the tissues in the lower leg, pressure ulcers, both in the lower extremities and along the back or the buttocks. Those are the major ones. We see other wounds after people have had surgical procedures or after they've had tumors removed, skin cancers. Once we've identified the cause, making sure that there's nothing else complicating that, and then coming up with a strategy that's going to allow nature to take its course. We use a lot of standard wound care treatments, which would be antibiotics, debridement, which is to remove infected or dead tissue from the wound. And wounds tend to become chronic, and what we're trying to do is restart the healing by removing any dead tissue. We use ultrasound treatments. We use what are called living skin equivalents, which are biosynthetic skin constructs that use growth factors to stimulate the formation of new tissue. In general, most of the patients that come to the wound care clinic are referred by their physicians. If patients have wounds and they feel like they need some help, they can call the wound care center directly.